What if your body has been warning you about diabetes and you've been ignoring it every single day? Before any blood test, before any diagnosis, the signs may already be visible right on your feet. And today, what I'm about to reveal could change how you see your health forever. Most people believe that diabetes can only be caught by a blood test. You go to your doctor, the lab work comes back, and that's when you find out. I understand why people think that. For years, that's what most patients told me too. My name is Dr. Richard Ben, and I've been practicing medicine for over 20 years. And what I've learned, what I see confirmed in my office every single week, is that your body starts warning you about high blood sugar long before any lab result ever would. And the very first place your body speaks up, your feet. The reason I'm making this video today is because of how many patients I've seen walk into my office, or worse, walk into an emergency room, who had every warning sign for months, sometimes years, and never knew what they were looking at. Today, I'm going to change that for you. Just last month, I sat down with a patient, a 67-year-old man, retired, healthy lifestyle, felt fine. He came in for a routine checkup. But before we did any blood work, I asked him about his feet. He told me, "My feet have been a little numb for a while. I figured it was just age." He had 4 of the 9 signs I'm going to show you today. His fasting blood sugar came back at 214. He was diabetic and had been for over 2 years without knowing it. So today, I want to show you exactly what I showed that patient. 9 signs that were already on his feet and on millions of feet right now that almost nobody recognizes for what they are. For each one, I'll tell you what most people assume it is, what's actually happening inside your body, and one simple daily habit that can protect you. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people walking around right now with a silent condition quietly damaging their nerves, their kidneys, their vision, and yes, their feet. The good news, a $12 blood test can catch this early. But first, you need to know what to look for. So let's get into it. Sign number 1 is something almost every patient has already experienced, and every single one of them has explained it away. Tingling, numbness, that pins and needles feeling in the feet. My patients almost always tell me, "Dr. Ben, my foot just falls asleep sometimes. I was sitting with my legs crossed." And yes, that happens to everyone occasionally. But I always ask them, is this happening regularly without a clear reason? Because if the answer is yes, we need to talk about what's actually going on. Frequent recurring numbness or tingling in the feet. What doctors call peripheral neuropathy is one of the earliest signs that blood sugar has been elevated for some time. The extra sugar in your bloodstream begins attacking the outer protective layer of your nerves. It's a slow process, which is exactly why most people miss it. I use this analogy with my patients all the time. Think of your nerves like electrical wires. Every wire has a plastic coating around it. That coating is what allows the signal to travel cleanly from your brain to your foot. When blood sugar stays high, it's like an acid slowly eating through that coating. The wire still works for a while, but the signals start getting fuzzy. And that fuzziness, that's the tingling you feel. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of people with diabetes. It is the single most common complication, and it almost always starts in the feet, which means right now, tens of millions of Americans are experiencing this tingling and writing it off as nothing. Don't be one of them. My daily recommendation for every patient over 60, a 20 to 30 minute walk every single day. Not a jog, a walk. Movement is the best thing you can do to keep blood flowing to your feet and protect those nerve endings. And start reducing added sugar in your diet today, not next month, today. Sign number 2, and this one my patients describe as the most distressing of all because it doesn't hit them during the day. It hits them at night when they're alone and trying to sleep, and there is nothing to distract from it. A lot of my patients chalk this up to being on their feet all day, or the summer heat, or just fatigue. And sometimes that's exactly what it is. But when a patient tells me their feet feel like they're on fire, especially at night when they're lying down, I take that very seriously. Burning in the soles of the feet, particularly at night, is a classic early sign of diabetic neuropathy. What's happening is this. The nerves in your feet have been damaged by excess sugar, and now they're sending incorrect signals to your brain. Your brain receives a heat message even though nothing hot is touching your foot. The nerves are misfiring. Think of it like a fire alarm with a faulty sensor. The building isn't on fire, but the alarm is going off anyway because the sensor is damaged. Your nervous system is doing the same thing. The burning isn't coming from outside your body, it's coming from inside damaged nerve tissue that is crying out for help. Research published in the journal Diabetes Care found that burning foot pain is one of the first reported symptoms in patients later diagnosed with type 2 diabetes, often presenting 1 to 3 years before formal diagnosis. 2 habits I recommend for this one. First, drink at least 8 glasses of water a day. Proper hydration helps your kidneys flush excess glucose and supports nerve tissue. Second, add more fiber to every meal. Vegetables, legumes, oats. Fiber slows the absorption of sugar into your bloodstream, which is exactly what those damaged nerves need. Sign number 3, and I need you to pay very close attention here, because this is the one that stops being uncomfortable and starts becoming genuinely dangerous. This is the one that sends the most patients to the emergency room. They come in and say, "Dr. Ben, I had a little blister from my shoe 3 weeks ago. It still hasn't healed." They waited. They assumed it would close on its own. Most small wounds do heal on their own, but not when blood sugar is elevated. When blood sugar is consistently high, your body loses its ability to heal efficiently. The blood vessels throughout your body, including the tiny ones in your feet, begin to narrow and stiffen. This means that oxygen, white blood cells, and the nutrients that repair tissue simply cannot reach the wound fast enough. The wound sits there, open, vulnerable, and slow to close. Imagine trying to water a garden, but your hose has a serious kink in it. The water is there, but it's not getting where it needs to go. That's exactly what high blood sugar does to circulation in your feet. The healing ingredients exist in your blood, and they just can't reach the wound. And an open wound that won't close is an infection waiting to happen. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, over 100,000 per year. Almost all of them were preceded by a small wound that was ignored. After your bath or shower tonight, sit down and look at both feet carefully. Look between every toe. Look at your heels. If you see any cut, blister, or broken skin, clean it with mild soap and water. Apply an antiseptic and cover it. And if it hasn't improved in 48 hours, call your doctor. Not next week, 48 hours. Sign number 4. And this one is hiding in plain sight. Most people walk past it every single day without realizing what they're looking at. It's visible. It's been there. And almost nobody connects it to blood sugar. Patients see their feet turning darker or more reddish, and they tell me, "I think it's just sun damage," or "I've always had dark skin on my ankles." And that may be true, but there is a specific pattern of discoloration, particularly around the ankles, that I look for when assessing blood sugar risk. When circulation is compromised by high blood sugar, the lower legs and feet don't receive enough fresh, oxygenated blood. The skin changes color as a result. You may see darkening deep red or even a bluish tint around the ankles. This is your skin telling you that blood flow to that region is inadequate. In some patients, the skin also becomes thinner and more fragile in those areas. Another sign that the tissue is not being properly nourished. I always explain it to patients this way. Think of your blood as a delivery truck carrying oxygen and nutrients. Your feet are at the end of the longest delivery route in your body, further from your heart than any other part. When the roads narrow because of damaged blood vessels, the deliveries stop arriving on time. The skin, starved of fresh oxygen, changes color. It's a distress signal you can see with your own eyes if you know what you're looking for. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. The daily habit here: 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even that small amount of movement gets blood flowing into your feet. And if you can't exercise, elevating your feet slightly while you sit can make a meaningful difference. Sign number 5, and this one surprises my patients the most because it looks completely harmless. In fact, most people have had it for years and never once connected it to blood sugar. Dr. Ben, my heels crack every winter. It's just dry skin. I hear that constantly. And yes, that's extremely common. But when your heels are cracking badly in the middle of summer, or no moisturizer seems to help no matter how much you use, that's a completely different story. Diabetes affects the autonomic nerves, the ones that control automatic functions you never have to think about. One of those functions is regulating moisture and sweat in the skin. When these nerves are damaged, the sweat glands in your feet stop working properly. Your feet lose their natural moisture from the inside out. No amount of lotion fixes the root cause. Think of your skin like a wall that needs to stay sealed. When those autonomic nerves are damaged, the mortar between the bricks starts crumbling. Cracks appear. And those cracks in the skin of your feet are not just cosmetic. They are open doors for bacteria and infection. In a foot with poor circulation, that infection can become very serious very quickly. I have had patients come in with cracks so deep in their heels were bleeding, and they told me they had been putting lotion on it for 2 years with no result. That's not a skin problem, that's a nerve problem.